Neurologist warns, if your nails look like this after 60, your body can be hiding 4 diseases. Take a moment right now to truly examine your fingernails. Look beyond the polish or the need for a trim. Focus on the very surface, the shape, any subtle ridges, the color at the base where the skin meets the nail, and how that skin sits around the nail. It's a surprising truth that most adults have never genuinely observed their own nails. They've likely filed them, painted them, perhaps even chewed them down during moments of stress, but they haven't taken the time to read them. This oversight is significant because your nails might be offering vital, early warning signs from your nervous system, kidneys, liver, and brain. Communications your body has been attempting to send for months, if not years. As Dr. Franklin, a neurologist who dedicates her career to understanding how systemic diseases manifest through the body's peripheral systems, including the skin, extremities, and nails, before any overt clinical symptoms appear, emphasizes nails are far from merely cosmetic. They are, in fact, a rich source of neurological and metabolic data. After the age of 60, the body's ability to compensate for subtle internal dysfunctions begins to diminish. The biological reserves that effortlessly sustained bodily functions in one's 40s become more strained. This isn't a failing of aging itself, but rather a narrowing of the margin between a state of quiet struggle and the onset of a health crisis, a margin that shrinks with each passing decade. Within this increasingly constricted window, nails emerge as one of the few visible indicators where the body continues to leave a discernible trail of its internal status. In this exploration, we will delve into 4 distinct nail appearances, each linked by published medical research to serious conditions that disproportionately affect individuals over 60. These conditions involve the brain, the nervous system, the kidneys, and systemic metabolism. These are not rare ailments. They are, in fact, common conditions that your doctor might not have specifically discussed during a standard appointment, not due to any intentional omission, but simply because the constraints of a brief consultation do not allow for an exhaustive examination of every potential health indicator. The 4th sign we will discuss is particularly crucial, deliberately saved for last, because it is frequently observed in patients presenting with a history of vague, unexplained neurological symptoms such as fatigue, mild cognitive fog, or tingling in the hands, symptoms that are seldom connected to the state of their nails. Before we proceed, consider sharing your age in the comments and whether you have ever been diagnosed with a vitamin deficiency, a kidney condition, or any neurological issue. Your response may influence how closely you pay attention to the information that follows. If this channel is new to you, please consider subscribing now, as the insights shared here are invaluable for every adult over 60, information that should not be confined to the limited time of a scheduled medical appointment. Let us begin by understanding a fundamental aspect of fingernails that is often overlooked: their origin. Nails develop from a specialized structure known as the nail matrix, a band of actively dividing cells located just beneath the cuticle at the base of each nail. These cells are not isolated entities. They are in constant communication with your bloodstream, your peripheral nervous system, and your overall metabolic environment. Every nutrient your body absorbs, every toxin it attempts to eliminate, and every inflammatory signal circulating through your system inevitably passes through the tissues that nourish the nail matrix. To visualize this, think of your nails as a biological record. Much like a geological core sample reveals layers of Earth's history, your nails, by growing approximately 3 millimeters per month, gradually encode information about your body's internal state during their growth period. A nutritional deficit experienced 3 months ago might manifest as a noticeable ridge across the nail today. Similarly, a chronic metabolic issue could present as a persistent alteration in nail shape or color that has been developing over several years. Particularly after the age of 60, the peripheral nervous system and the intricate network of nerves extending from the spinal cord to the extremities become more susceptible to the impacts of nutritional deficiencies, insufficient vascular supply, and systemic inflammation. Given that the nail matrix is supplied by peripheral blood vessels and is adjacent to nerve-rich tissues, it frequently reflects distress in these systems before any other visible symptoms emerge. The absence of a detailed nail examination during routine primary care visits is not due to negligence on the part of physicians, but rather because a thorough nail assessment as a diagnostic screening tool is not yet standard practice unless a clear visual abnormality is present. Consequently, potential indicators that could prompt earlier investigation often go unnoticed, sometimes for extended periods. Therefore, it is crucial to know what to look for. We will examine 4 specific signs, each associated with distinct conditions, and conclude with a simple self-test that can be performed in about 10 seconds. Sign 1. Longitudinal ridging and Parkinson's disease risk. The first sign that many adults over 60 encounter is longitudinal ridging, characterized by vertical lines running from the base of the nail towards the tip. These ridges can be fine or pronounced enough to catch a thumbnail, while mild, faint vertical ridging that appears symmetrically on most nails after 60 is often considered a normal aspect of aging, as the nail matrix, like all tissues, becomes less efficient in producing a perfectly smooth nail plate with age. There is a specific pattern of ridging that signals something more significant. This distinct pattern involves ridging that is noticeably deeper on one hand compared to the other, coupled with increasing nail brittleness over a period of 12 to 24 months. This deterioration is further accompanied by subtle changes in finger tremor, the size of one's handwriting, or a decrease in grip strength. This asymmetric progression of nail changes, particularly when more pronounced on the dominant hand and co-occurring with other indicators of peripheral nerve involvement, has been documented in clinical literature as being associated with the early stages of Parkinson's disease. The neurological relevance here is critical. Parkinson's disease, in its nascent phases, is not primarily a movement disorder but rather a condition affecting the peripheral and autonomic nervous systems. The dopaminergic cells in the substantia nigra, which are commonly linked to Parkinson's, are not the first to be impacted. Research into the prodromal phase of Parkinson's, the period that can precede a formal diagnosis by up to a decade, reveals that autonomic nervous system dysfunction, including changes in skin and nail health related to nerve supply, can manifest years before any tremor becomes clinically apparent. The autonomic nerves responsible for regulating blood flow and sweat gland activity in the fingertips also play a role in the environment surrounding the nail matrix. When these nerve signals become less consistent, a phenomenon seen in early autonomic dysfunction, the quality of the nails can change in ways that a meticulous observer might detect. It is crucial to understand that isolated vertical ridging does not indicate Parkinson's disease. It does not even suggest it on its own. What is significant is the pattern, asymmetric progression, combined with changes in handwriting size, any newfound tendency to shuffle when walking, altered arm swing, or a diminished sense of smell. A reliable early marker of Parkinson's in its prodromal phase that is often overlooked until much later. Consider the case of a 67-year-old gentleman whom we will call Raymond. He initially sought consultation because his wife had noticed a significant reduction in his handwriting size over the preceding 18 months. Upon examination, the ridging on his left thumbnail was markedly more pronounced than on his right. He mentioned that his left thumbnail seemed to break more easily, attributing both to his being right-handed. Almost as an afterthought, he also noted that his sense of taste and smell had diminished over the past year or two. The convergence of these findings, rather than any single symptom in isolation, prompted a referral for a comprehensive neurological evaluation. His diagnosis of early-stage Parkinson's disease was confirmed. The early detection allowed for treatment initiation at a stage where it could meaningfully preserve his quality of life for a considerably longer period than if a more advanced clinical presentation had been awaited. The practical takeaway is straightforward. Pay close attention to your thumbnails. Compare both hands under good natural light. If the ridging pattern appears noticeably different between your left and right thumbnails, thumbnail, document this observation. Note any changes in your handwriting size. Observe any alterations in your sense of smell. And at your next doctor's appointment, request a neurological screening. Sign 2, Bowes lines and kidney disease. The second sign is one that individuals often notice with a degree of suddenness, but rarely comprehend its underlying message. Examine your nails for horizontal lines or grooves that traverse the nail width rather than running along its length. These are known as Bowes lines, named after the French physician Joseph-Honoré Simon Bowes, who first described them in the 1840s. Bowes lines arise when a significant disruption occurs in the nail matrix, temporarily halting its normal production of nail tissue. As the matrix recovers and resumes growth, the nail advances, leaving behind a groove at the point of interruption. A single Bowes line that appears simultaneously on multiple nails often signifies a major systemic illness, a severe infection, a high fever, or major surgery. If you experienced COVID-19 in the past 2 years and now observe a noticeable groove crossing several of your nails, this is likely what you are seeing. This specific manifestation became so widely recognized following the pandemic that dermatologists informally termed it COVID nails. However, it is crucial to understand that recurring Bowes lines, multiple grooves appearing at different levels across a nail, or grooves that repeatedly emerge without any evident illness, tell a different story. In adults over 60, recurring Bowes lines that cannot be attributed to a single, clear episodic illness have been associated in clinical literature with chronic kidney disease. This connection stems from the kidney's vital role in filtering waste products from the blood, including metabolic byproducts that can become toxic when they accumulate. A consequence of failing kidney function is uremia, a condition characterized by the buildup of urea and other nitrogen-containing waste products in the bloodstream. These toxins are directly damaging to rapidly dividing cells, and the cells of the nail matrix divide more quickly than most other tissues in the body. When uremia begins, even at subclinical levels before any overt symptoms appear, it stresses the nail matrix sufficiently to disrupt normal nail growth. Chronic kidney disease affects a substantial proportion of adults over 60, and in its early stages, it is often asymptomatic. Many individuals remain unaware of early chronic kidney disease until a blood test reveals it, yet some have been observing the recurring grooves on their nails for years, dismissing them as insignificant. Another nail sign specifically linked to kidney disease, and often appearing alongside Bowes lines in the same individual, is what is known as half-and-half nails, or Lindsay's nails. This condition is characterized by the lower half of the nail appearing white or pale, while the upper half, closer to the tip, presents as pink or brownish, with a relatively sharp demarcation between the two colors. This pattern has a strong documented association with chronic renal failure. If you observe both Bowes lines and a distinct color change between the lower and upper halves of your nails, this combination warrants a very specific discussion with your doctor regarding kidney function. Consider the case of Margaret, a 71-year-old woman who had been noticing grooves crossing her nails intermittently for about 3 years. Each time, she assumed she had experienced a mild, unnoticed illness. While she was correct that something had been stressing her system, she was unaware that her kidneys had been gradually declining in function since her late 60s. When she eventually presented for an unrelated neurological complaint, persistent leg cramping, and a mild morning cognitive fog, the combination of her nail findings and her symptoms prompted a comprehensive metabolic panel. Her estimated glomerular filtration rate, eGFR, the standard measure of kidney filtration rate, was significantly below normal for her age. Early-stage chronic kidney disease was confirmed. Through dietary modifications and careful medication management, her kidney function has since been stabilized at a level where her prognosis is considerably better than if the condition had been discovered 2 or 3 years later. The practical takeaway here is to examine the width of your nails, not just their length. If you notice one or more horizontal grooves and cannot attribute them to a single episode of significant illness, specifically ask your doctor for kidney function blood tests, including a basic metabolic panel with creatinine and eGFR. If you also observe a sharp color change between the lower and upper halves of your nails, mention this explicitly and inquire about a renal function assessment. Sign 3. Spoon nails and the brain-body deficiency connection. The third sign establishes a more direct and often surprising connection to neurological health. Observe the shape of your nails from a side profile. Most nails exhibit a gentle downward curve over the fingertip, forming a soft arc that mirrors the natural contour of the finger. However, some nails, over time, begin to curve in the opposite direction. Instead of bending downwards, the edges of the nail lift upwards, and the center becomes concave, resembling a small spoon. If you were to place a tiny drop of water on such a nail and it did not roll off, it indicates that the nail has spooned. This condition is medically known as koilonychia. In adults over 60, koilonychia is a particularly important nail sign to recognize, not solely for what it reveals about the body's general state, but crucially for its implications regarding brain health. Koilonychia is most classically associated with iron deficiency. However, the connection that is frequently not conveyed is that iron deficiency in adults over 60 can extend beyond mere fatigue to encompass neurological symptoms and cognitive impairments, including memory-related issues. These symptoms in older adults are often mistakenly attributed to the natural process of aging or even to early-stage dementia, when in reality, the underlying cause is a correctable nutritional deficiency. Iron is not merely a component of red blood cells. It is indispensable for the synthesis of myelin, the protective sheath that insulates nerve fibers and ensures the rapid transmission of electrical signals. It is also vital for the production of several neurotransmitters, including dopamine and serotonin, and plays a direct role in the metabolic function of the frontal lobe, the brain region responsible for executive functions, memory retrieval, and processing speed. When iron stores deplete, a process that can occur silently in older adults due to various factors, such as reduced dietary intake, medication side effects affecting absorption, or subclinical gastrointestinal bleeding, the brain is one of the first organs to experience adverse effects. The nails, being formed by rapidly dividing cells that are highly sensitive to iron availability, can display structural changes well before the neurological consequences become clinically evident. The typical neurological presentation of iron deficiency in an older adult often includes disproportionate fatigue relative to activity levels, difficulty concentrating on tasks that were once effortless, a perceived mental slowing, and sometimes restless legs at night. This persistent, uncomfortable urge to move the legs when at rest is one of the more commonly overlooked symptoms of iron-related neurological stress. If you notice that your nails are gradually becoming more concave, with raised edges and a hollowed center, and you are experiencing any combination of these neurological symptoms, the possibility of iron deficiency anemia needs to be thoroughly investigated by your doctor with a simple blood test before more serious conditions are considered the cause. The critical aspect here is that treating iron deficiency anemia in an older adult experiencing cognitive symptoms can, in many instances, lead to significant and measurable improvements in brain function. These changes are often not irreversible. They can be the reversible consequences of a correctable deficiency, but they will not be addressed if the underlying cause is not identified, and the cause is unlikely to be investigated if the nail sign that could prompt such an investigation goes unnoticed. Sign 4. The disappearing lunula and what your nervous system is losing. This is the sign I promised you would be worth waiting for, and it's one you can check right now as we speak. Look at the base of your thumb, just above the cuticle, where the nail begins to emerge. Do you see a pale, whitish, crescent-shaped area? This is your lunula, the visible portion of your nail matrix, the living tissue responsible for producing new nail cells. In a healthy adult, the lunula should be clearly visible on both thumbs, typically visible on the index fingers, often discernible on the middle fingers, less reliably on the ring fingers, and almost never on the pinkies. And this pattern is entirely normal. Now, pay closer attention. Is your lunula still clearly visible on your thumbs, or has it receded beneath the cuticle, becoming invisible? Can you still see it on your index fingers? Has it transformed from a distinct white crescent into a faint suggestion of color? The gradual disappearance of the lunula, a condition known as absent lunula or nail matrix atrophy, has been documented in medical literature in association with several serious systemic conditions. However, the one that concerns me most profoundly as a neurologist, and one that is rarely discussed in the context of nail health, is vitamin B12 deficiency and its downstream consequence, subacute combined degeneration of the spinal cord. This is a term that likely sounds unfamiliar to most, so let me explain it simply. Vitamin B12 is one of the most critically important nutrients for the nervous system. It is essential for the production of myelin, the same protective coating I mentioned earlier in relation to iron. Without adequate B12, the myelin that sheaths your spinal cord and peripheral nerves begins to degrade. This process is termed subacute combined degeneration, and it can lead to symptoms such as numbness and tingling in the hands and feet, difficulties with balance and coordination, muscle weakness, cognitive changes including memory disruption, and in advanced cases, severe and sometimes irreversible spinal cord damage. What makes B12 deficiency particularly dangerous in adults over 60 is its tendency to develop slowly and silently, often due to metabolic factors rather than dietary choices alone. After the age of 60, the stomach lining produces less intrinsic factor, a protein crucial for the absorption of B12 from food. Furthermore, many common medications prescribed to older adults, such as metformin for diabetes and proton pump inhibitors for acid reflux, can further impede B12 absorption. Consequently, a significant proportion of the over 60 population may be B12 deficient without realizing it, as routine blood panels in many clinical settings do not automatically include B12 levels. The nail matrix, being one of the most metabolically active tissues in the body, often reflects the consequences of B12 deficiency years before the neurological symptoms become unmistakable. The lunula begins to shrink. The nail matrix, no longer receiving the essential nutrients for its full productive activity, retreats beneath the cuticle. Consider the case of Evelyn, a 73-year-old retired school teacher who presented with concerns from her family about her declining memory. She was forgetting recent conversations, occasionally felt unsteady on her feet, experienced nighttime tingling in her hands, and her neurological examination revealed reduced vibration sensation in her lower limbs, a classic early sign of subacute combined degeneration. Upon examining her hands, both of her lunulae had completely disappeared. She had no recollection of when she last saw them. Her B12 level was found to be critically low. She had been taking a proton pump inhibitor for nearly a decade, and her dietary intake of B12 was minimal. With high-dose B12 supplementation initially administered via injections due to her severely compromised absorption, her symptoms improved significantly over the subsequent months. Her balance largely returned to normal, and her cognitive fog substantially lifted. Her lunulae, while not fully regaining their previous prominence, began to reappear at the base of both thumbs within 3 months. This positive outcome was possible because the issue was identified, and the initial clue was the state of her lunulae. To summarize the actionable steps, take your hands to a window with good natural daylight and examine each nail carefully. Hold both hands side by side to compare their overall texture, quality, and appearance. Note if one hand looks noticeably different from the other, and correlate this observation with any recent changes you've noticed in your sense of smell, handwriting, or sleep patterns. Look for any horizontal grooves spanning the width of your nails. Check the side profile of your nails to see if any have begun to form a concave shape. And finally, inspect the base of your thumbs and index fingers for your lunulae. Take photographs of both hands, ensuring the lighting is even and the image is close enough to clearly see the nail base. Date these photographs and save them somewhere you will be able to retrieve them. Within the next week, if any of the 4 signs discussed today align with what you've observed, meticulously document it. Identify the specific sign, which fingers are affected, how long you have noticed it, and any accompanying symptoms such as numbness, tingling, fatigue, memory fog, or leg cramps. Within the next 30 days, if you've identified 2 or more of these signs, or even one sign coupled with neurological symptoms, do not delay until your annual physical. Contact your doctor's office this week and request a B12 level check, a complete blood count including iron studies, a basic metabolic panel for kidney function, and specifically ask for a neurological screen if your symptoms involve your hands, feet, balance, or cognitive function. The most crucial point to understand is that none of these nail signs constitute a diagnosis in themselves. Each requires clinical context, your complete medical history, current medications, other symptoms, and a physician's examination. What these signs do provide is a prompt, a compelling reason to initiate a conversation that might otherwise be postponed, a valuable thread worth pulling for further investigation. The neurological conditions discussed today, early Parkinson's disease, chronic kidney disease, iron deficiency with cognitive impact, and B12-related spinal cord and brain dysfunction, share a critical characteristic. They are all significantly more treatable when detected early rather than late. Furthermore, they are all conditions where early detection is frequently achievable if one knows what signs to look for. You now possess that knowledge. Your body has been your most steadfast companion for 6 decades or more, continuously communicating through sensations, symptoms, and surface signs on your skin and nails that most people have never been taught to interpret. Those nails you may have glanced at dismissively this morning could be the most honest diagnostic window your body has offered you this year, provided you have the vocabulary to understand their silent language. I am eager to hear from you. In the comments below, please share whether your lunulae are currently visible on both thumbs. Additionally, mention one symptom you have been quietly overlooking for the past year that you might reconsider in light of the information presented today. I read every comment and respond to as many as possible. If this video has been helpful, please share it, not for the algorithm, but for someone you know over 60 whose nails might be telling a story they have yet to learn to read. Subscribe to the channel if you wish to continue receiving content of this nature. What we are building here together is a community of adults who refuse to accept that essential health information is solely accessible within a medical setting. It belongs with you wherever you are. I look forward to seeing you in the next video.